Hello friends, my name is Dr.Arunesh Kumar. I am Senior Consultant Pulmonologist and Head at Paras Chest Institute, Paras Hospitals, Gurgaon. Friends, we are going through a very difficult time. We have been attacked by an invisible enemy called novel coronavirus. Now, loads of information have been trickling in from all sources, be it social media, news, or from your doctors, from people around, from the newspapers. So I thought that this is a high time that we as a professional should come and answer the common questions you might have in your mind regarding this coronavirus. In this video today, I have handpicked few of the commonly asked questions and some myths surrounding the coronavirus infection. I will upload this video on different platforms. In the comments category, you can write your further questions and perhaps I might make another series of videos answering those questions if you have any. It's a myth. We have seen recently that the coronavirus outbreaks have happened in countries of different temperatures. For example, in cold areas as well as in warm and temperate areas like Singapore, Australia, where the temperatures were relatively high. So I don't think temperature will have any effect whatsoever on the viral virus transmission. Of course, it is a myth. We have seen one of the highest mortality rate in corona patients in Italy, where the temperature was cold and some part did have a snow at that time. So yes, cold weather and snow cannot kill virus. I'm afraid no. Taking hot bath doesn't prevent coronavirus, but actually washing your hands with soap and water with alcohol-based hand rubs do prevent it. So no. Well, it's a myth because novel coronaviral disease is a zoonotic disease, meaning thereby it spreaded from animal to human beings, and from there human to human transmission has been established. There is no role of mosquito in the novel coronaviral disease transmission. Well, hand dryers are a good adjunct in my mind, that you first wash your hand with soap and water or the alcohol based rubs, and you can super add it with the hand dryers, but super hand dryers alone are not sufficient to kill coronavirus. Well, ultraviolet disinfectant lamp doesn't have any role in the disinfection as far as coronavirus is concerned. On the other hand, it can give you some side effect to your skin in some cases. Well, thermal scanners are useful in detecting the people who have got a fever. Now, there are many causes of fever. Coronaviral infection is one of them. So, essentially, thermal screening doesn't diagnose a coronaviral infection, but at the same time, it helps the authorities to selectively screen these patients for coronavirus. No, I'm afraid spraying alcohol or chlorine doesn't help. This can be used as other disinfectant, but not as an antiviral disinfectant. No, vaccines against the pneumonia, such as pneumococcal vaccine or H influenza B vaccine, doesn't cover coronavirus, nor do the flu vaccines at the moment cover this. So none of these vaccines protect you against coronaviral infection. No, I'm afraid it doesn't prevent coronavirus spread. On the other hand, if you touch your nose regularly with your hand, increases the chance of coronavirus infection to others. Garlic has been an essential ingredient in our households, and in Ayurveda, it has been depicted as showing some antibacterial properties. But so far, with the existing literature, there is no evidence that it helps you against coronavirus. Evidences available so far suggest that novel coronavirus affects the people who are elderly, along with having other comorbidities like diabetes, blood pressure, and heart disease. Having said that, it also doesn't show that the younger generations are spared. So it does affect patients of all ages, but have got higher propensity towards the people who are elderly and have got comorbidities. Unfortunately, there is no role of antibiotics in preventing coronavirus disease. Having said that, people who are hospitalized with acute coronaviral infection, having severe acute respiratory infection, we do administer antibiotics to treat coexisting bacterial infection. There are no specific medications to treat coronavirus disease. There are certain drugs that are in the trial phase, but they are not evidenced enough to be used in regular anti-coronaviral treatment. Well, coronavirus infection started from Wuhan, from a live animal market, and it is a zoonotic disease. So naturally, the people who are non-vegetarians can get the viral transmission, but as long as this food is properly cooked, you can't get this virus transmitted across to you because the virus cannot stand that high temperature. For vegetarians, wash your food, wash your hand, and hopefully you should be all right with this. Well, this is the last question, but I think it is the most important question for me to answer. There are simple things which you can do that will definitely go a long way in preventing the transmission of virus further. First of all, we have got 3 apertures: eyes, nose, and mouth, that already stage on the top, and these are the portals through which the virus enters your body. Frequent hand washing is very important because this by doing this you reduce the contamination from the hand to any other surface area or your face you touch. So I recommend frequent hand washing. You can do it with either soap and water or any alcohol based hand rubs. Next important thing is cough etiquette. So when you cough, try and put a handkerchief or your arm in front of you so that the transmission of the droplets don't happen beyond you. When you cough, your droplets travel up to a meter in front of you. So anybody who is standing in that vicinity gets infected. So this is one of the most important thing to cut the transmission. Third thing is social distancing, which we all doing these days, is at least maintain a distance between 1 to 2 meters between the 2 individuals if possible, because that's when the transmission happen if you stand under it. Fourth thing is stop touching your face with your hands. I hope you found my video useful. Please leave your comment or any questions in the comment sections below. I will try and answer those questions in my subsequent videos. Thank you very much for watching. Stay home, stay safe.